My name is Kim Trout, and I am a nurse midwife, and I direct the Nurse Midwifery program at Georgetown University School of Nursing and Health Studies. So a women's health nurse practitioner is an advanced practice nurse who is educated in many of the same skills that nurse midwives are. However, the women's health nurse practitioner's role is purely ambulatory in that women's health nurse practitioners do not attend women in labor and birth. Because their focus is more on ambulatory care, many women's health nurse practitioners will specialize in certain advanced practice procedures such as ultrasound or colposcopy. A nurse midwife is an individual educated in the two disciplines of nursing and midwifery, and as such, she brings skills through her education in those disciplines to care for women, newborns, and their families throughout the lifespan. A typical day for a nurse midwife can vary quite a bit depending on the location of her practice, her clinical practice. When I worked in a small rural practice in central Pennsylvania, I had 2 families where I had delivered 4 babies in each of those families. So the women would come in, by the 4th one, and they'd say, "Okay, where's Kim?" I was sort of the family midwife. And then to see the older siblings as they were growing up and helping to participate, the experience of seeing their newborn brother or sister, it's just hard to describe in words. You do have an impact on families. You're helping them get started, and you're doing everything you can to nourish the development of those families. So midwives don't view pregnancy and childbirth simply as a medical event. It's a family event. The look on a mother's face when she holds her baby outside of her body for the first time and meets that baby, there's nothing more beautiful in the world. So that's definitely a true reward. To be able to witness that moment is really a holy and sacred thing.